say, will move to another level. So this is why we're here today. We're really looking for movement on healthcare so that we don't have to keep telling the same stories we've told for generations. In fact, the stories get worse with each generation on healthcare. Because Nigeria really does face a crisis in our moment in this journey of developing our healthcare. The country's healthcare system has provided inadequate funds, resources, consumable to face the needs of the Nigerian people. Recently, the presidency proposed a 2018 appropriation bill. And we looked at the content and it was very underwhelming. In fact, contributions to healthcare have fallen since last year. Nigeria did sign the Abuja Declaration, which we ourselves committed to ensuring that 15% of our national budget will go towards healthcare because that's the kind of resources it requires. As of last year, 2017, we were at 4.15%. Based on the proposal from this year's budget, we're at 3.95%. So we can talk about percents all day, but what does that really mean? We don't have enough resources to take care of the many Nigerians that we're bringing into Nigeria, that are being born. We don't have enough resources for basic standard minimum of health care. And that's what we've been asking for. The 1% Consolidated Revenue Fund requires a basic minimum standard for healthcare, that you can walk into any PHC across the nation and get a basic minimum standard of care. And our folks have advocated for the National Health Act to be passed, and that took 12 years, as you mentioned. 12 years of tears, blood, and sweat for us to get that passed. And as we sit today, it's not being implemented. In September 2017, one along with 30 CSO organizations signed an open letter to His Excellency President Buhari asking for an increase to the health budget. So even if we don't get to 15% this year, let's at least get to 7.5%. We also asked for the 1% Consolidated Revenue Fund to be implemented for that basic minimum standard. As we speak today, neither of those things have been done. We don't have an increase to the health budget. In fact, we have a decrease to it. In real terms, in nominal terms, the health budget increased. The amount has increased, but when you factor in inflation, the number of population we have in Nigeria, really how much naira does one Nigerian have for health care? It gets lower and lower every year. We urge the government to also have open contracting for health. What that means is that it's not enough to ask for more money for health. We have to ask for transparency for healthcare, because we can get more money, which is important. But at the end of the day, how is that money spent? If we don't track how that money is spent, if there's no openness and transparency in the health sector, we'll go back to square one, where there's more money, but we have no clue where it's being spent or how it's being spent. Judging from the proposal of the 2018 budget, we know that one, alongside 30 CSOs, have spoken to the presidency, spoken to Mr. President, but unfortunately our voices have not been heeded because this budget is very disappointing. In the last decade, we've seen a degrading in the quality of healthcare for Nigerians. We've seen that more Nigerian women are dying from preventable diseases, giving birth. Our wives, our mothers, our sisters, our daughters, for things that can be prevented. Nigeria takes pride of place among some of the worst statistics we see on immunization, vaccination, maternal mortality. And the response we've received from the federal government is, well, there are lots of things that we can do. Where do we prioritize? Our call today is for you to prioritize health. Without a healthy nation, we build nothing on agriculture. We build nothing on security. We can't build a Nigeria without a healthy nation. So the excuse of saying we're coming out of a recession, we can't prioritize health because there are other needs, is a poor excuse, and we find it to be unacceptable, in fact. because the lives of the very Nigerians that the budget and the government seeks to serve are being wasted for things that we can prevent. Fortunately, there's hope. In November 2017, the Senate mandated its Committee on Appropriation to include the 1% Consolidated Revenue Fund. That's good news. It means that the CSOs, the Nigerian population, have been advocating for this 1% funding for health, and the Senate is doing something about it. But the responsibility cannot rest with the Senate, because after that bill leaves the Senate and goes to the Joint House Committee and the 1% is retained, it has to go to Mr. President. So, Mr. President, we're raising our voices to ask for more resources for healthcare, in particular for the Basic Healthcare Provision Fund, in order that Nigerians get basic minimum standard of healthcare. We understand that there are priorities that you must focus on, but we're here to say that the health of Nigerians should be your priority. The National Assembly has demonstrated that they're listening. So, Mr. President, this message is for you. We would like you to demonstrate that you're listening and implement the 1% Consolidated Revenue Fund for a basic minimum standard of care so that the lives of Nigerians are treasured and we don't have the stories of us leaving our country in droves to seek better health care in different nations. We look forward to your voice and your participation, sir. The Nigerian people depend on this. Thank you.
On wheelchair, I initially did not pay much attention to it because I just said, well, it's normal. But on the second thought, when I looked at the number of people, I could not even count them. Because it was like a classroom full of invalids. But when they started checking them in, because you know you have to let them in before others, I started counting. I have the video and I can share it with you later on. You know, I started counting. After the fourth person, I decided to do a recording of it. I counted 27. 27 Nigerians who are on one flight from one city, from one country. There are several cities that night where Nigerians were also aboard aircraft or airlines. So if you added them all up, it tells you a story of how far we have gone, the death of the Nigerian healthcare delivery system. I did not know when tears ran through my face, because when I saw them, they brought in more people to carry them, to wheel them inside the aircraft. One aircraft, 27 people on wheelchair, just for one country. I walked back to other boarding gates. I did not even see. I went to the one going to Accra. There was not a single person. It shows us that, I hate to say it, but I must say it. It makes us look like a sick nation. But I'll go on to read what we have prepared as the Health Reform Foundation of Nigeria, working with the civil society organization for health sector reform, the coalition. Gentlemen of the press, we are happy to welcome you to this important press conference. Health Reform Foundation of Nigeria, Health Fund, and other civil society organizations under the Health Sector Reform Coalition, HSRC, want to discuss the implication of the government of the day not showing interest towards the implementation of the 1% Consolidated Revenue Fund, recommended by the law in the National Health Act, which was passed in 2014, to provide basic health care for all Nigerians, irrespective of their class, socioeconomic status, religion, or tribe. The Basic Health Fund is what will guarantee equitable access to quality health care for all Nigerians. As you are aware, the Nigerian health sector has become a major source of concern due to its poor healthcare delivery system caused by inadequate funding. Government's meager spending and countless support from numerous international agencies and donors have demonstrated little progress in health outcomes. In the Nigerian health policy, each level of care is tied to the different tiers of government. While the local governments are expected to be responsible for the primary health care, that means management of local dispensary, environmental sanitation and protection, and routine immunization, etc., the states are responsible for secondary care, which means like the general hospital, cottage hospitals, and the federal government is to focus on tertiary and apex referral institutions. In reality, the local authority delivery system has a weak delivery mechanism that disables them to perform these basic primary functions at that level. This has resulted in the high influx of patients from the secondary level to seek self-medication or relies on quacks for their healthcare needs. The states do not fare better in the discharge of their responsibilities for secondary care either, further jeopardized by the regular influx of PAC patients and clients. The overall bundled effect is that the tertiary centers bear the huge burden of servicing the healthcare delivery system of the country across board. Thus, federal funds expected to be deployed for tertiary healthcare become ineffective and inadequate. With yearly low budgetary allocation to the health sector, the prevalent inefficiency, lack of accountability and transparency further significantly create the low returns on value for money for health services delivered. While Nigeria is regarded as while health is regarded as a fundamental human right, the 1999 Nigerian Constitution does not give Nigerian citizens the unhindered right of access to quality and affordable healthcare at all levels. Recognizing this constitutional lacuna, the National Health Act 2014 was formulated and passed into law. The Act provides framework for the establishment of systems to support and facilitate far-reaching reforms in the Nigerian health sector and for achieving progress towards universal health coverage in Nigeria. It essentially seeks to guarantee access, both physical and financial, to basic health care for all Nigerians through the Basic Healthcare Provision Fund, to be financed through an annual grant of not less than 1% of Consolidated Revenue Fund of the Federation, which will be dispersed to states and local government areas. It is sad to mention that 3 years after the tortuous journey, it took us about 12 years to get the bill passed, of signing the Act into law, its implementation has been slow with zero funding commitment to the basic health care package through services in each year's budget. What does this mean? We always like to draw your input on action or inaction to an outcome. What does this mean? 3 years of lack of funding. The outcome of this means that several Nigerians have died that would have had access to primary health care, but they did not have. So they've died, leaving several orphans. Some homes are being managed right now by some 15, 12-year-old because their parents died. So it's a hopeless situation. So this is part of the thing because of lack of access for 3 years. And many more will go if we don't make the budget available. The fund, of course, we know cannot solve or perhaps meet the huge health needs of all Nigerians. However, it is designed to serve as a catalyst fund that could pull further funding for the health sector. It's supposed to be catalytic, but for 3 years we've not had it. 45% of the basic health fund is to be used by the National Primary Healthcare Development Agency. to procure vaccines for 3 years. They don't have that fund. And other essential commodities. 50% goes to the National Health Insurance Scheme, NHIS, to provide basic coverage for the Nigerian masses, while the Federal Ministry of Health will use the remaining 5% for accidents and emergency response. So these are what they are supposed to do. And so we know for us not to have funding in the last 3 years, you know the implication. It can only be imagined. What this accident and emergency response means is that the law bars the cost of treatment for every accident and emergency patient. And we know Nigeria is topping the list in terms of accident cases right now, globally. We are, however, worried that this law that favors Nigeria populace, that the poor, has not received the desired attention it deserves. Promises have been made for the implementation of the fund, but each year, when the budget is read, Nigerians are always disappointed that it is not there. What this means is that even in 2018, our health system will not see any change. The federal government is hereby called upon. We're calling on the federal government, the president, the members of the Federal Executive Council, our Senate, our House of Rep members, state governors, state houses of assembly, local government. You are being called upon to follow these recommendations that we have and take urgent action. We all remember the Abuja declaration of 25% to health. As we speak, we're still below 5%. So our recommendation include, without hesitation, the 1% of the Consolidated Revenue Fund of the Federation in the 2018 annual budget to fund the basic health care package. 2, support states to set up governance structures. Governance structure, one of the bane of our health sector is governance. So support states to set up governance structures for the domestication of National Health Act and ensure that it deepens its engagement with state-level actors and stakeholders to increase buy-in and ownership of the operationalization process. Third point, states to make annual budgetary allocations to sustainably meet the counterpart funding requirements for accessing the federal grant through Basic Healthcare Provision Fund, as well as work towards establishing state primary healthcare development boards backed up by relevant laws. The Senate and the House Committee on Health should periodically monitor the operationalization of the National Health Act as part of their constitutional oversight function. That's accountability. The other point is to reactivate the steering committee and technical working group, TWG, and ensure that the 5 subcommittees meet regularly to deliver on their respective mandates. These committees have not been meeting largely because of funding. Next point is that they should review the guidelines and regulation of the standing committees to fast-track the National Health Act implementation. Finally, we should set up a monitoring and accountability framework for the implementation of the National Health Act to ensure that the key milestones are achieved within reasonable time frame to forestall the current delays being experienced. Thank you and God bless you.
As we speak, only 4 states, and I want to applaud some of those states, that have made the 15% mark, and that is Bauchi, Gombe. And as we speak, the Kano state government is almost 12.5%, and they have actually implemented 1% consolidated revenue of all the local governments to be put into their healthcare sector in the 2018 budget. I think we should applaud them for that. They have shown promise. So when you aggregate all that, we are still not anywhere 15%. This year is 4.1%. We have also seen that if we invest properly in the primary health care centers, then the huge maternal health and death burden that we have will reduce maximally, because the National Health Act is actually putting money where it should be, and that's at the primary health care level. 45% of that money will go there. And the vast majority of the resources coming from the 50% to National Health Insurance Scheme will also go there. And there are 9 services, 9 maternal, newborn, child, adolescent health services that will be taken care of at that level. And that also includes issues like paying for family planning, making sure women have children when they want, they space their service, their childbirths properly. We will reduce maternal mortality by 30%. So there are huge gains for this investment. So I would want to, in this regard, also call on Mr. President and the members of the National Assembly. They are already doing so much. We do know that accountability is the issue. There's a lot of corruption, and everybody has agreed that the government is fighting corruption, and we commend Mr. President for his focus on corruption. But not only corruption, we should also increase the quantum of money by making sure that we have the National Health Act properly funded, and then it will also take care of, as we increase our budget as the year because of inflation, we'll also increase the budget to health. I thank you, ladies and gentlemen.
And like he has said in his speech, is the issue of implementation of the National Health Act. That act that took almost 12 years to be passed is still lying fallow. Nobody is using it, and that is where we are here today. The issue of disability, accountability, transparency in terms of health system is all enshrined within the law, within the acts, and they are there. The legal framework is there. Going against that act, it's a crime, because that act is a law. So we believe that when we ourselves, if I would do a census right now and ask us, how many of us here knows what is inside the act? What does it say about you and I? What does it say about your right to demand for quality health care? That is where it starts from. So first we need to get to know what is inside it. Now, one of the issues that is being covered is that the issue of physically challenged persons is well taken care in the bill, because there's a provision for them within the act. For children, for elderly, for women, everybody are well taken care with the act. So going back, if we can push for the implementation of the act, where there needs to be other policy work or guidelines to come on board, then definitely those gaps will be filled up. But the legal framework to set things right is already in place. So we must continue to enforce and advocate for the implementation. Also, at HEFON, we are also working with different levels of government, from the federal down to the state government. The issue of open government and open data. Even when we're asking questions, the government, we do not even have access to some information. They see it like, what are you talking about? So we need to keep on asking, and the media needs to help us with this. And one of the things we are going to ask media to do is that we need to track, not just tracking when the budget is being passed, but when it's being implemented. What are we using the funds for? By whom? We need to follow the money down to the results. I think that's basically my own contributions, and we'll continue to partner with everybody to ensuring that better health for all Nigerians. Thank you.